Bismillahirrahmanirrahim. Today my topic of presentation is patient safety and minimal service delivery standards in Punjab, Pakistan. A little progress each day adds up to big results. Learning objectives of today's presentation is patient safety introduction, its definition, causes of various healthcare error, patient safety and universal health coverage, patient safety and WHO, strategies to improve patient safety challenges, Global Patient Safety Action Plan from 2021 to 2030, Minimum Service Delivery Standard MSDS, some recent advances and MCQs. Learning of outcome. By the end of this presentation, participants will be able to describe the patient safety introduction, causes of healthcare, patient safety and universal healthcare, and patient safety and WHO, strategies to improve patient safety, various challenges, and Global Patient Safety Action Plan 2021 to 2030, and MSTS. Patient safety. It is a framework of organized activities that creates culture, process, procedures, behavior, technologies, and environment in healthcare that consistently and sustainably lower risk, reduce the occurrence of avoidable harm, make error less likely, and reduce the impact of harm when it does occur. Patient safety, according to WHO, is a healthcare discipline that emerged with evolving complexity in healthcare system and resulting rise of patient harm in healthcare facilities. It is a cornerstone of discipline and it is continuous improvement based on learning from errors and adverse events. It is actually fundamental to delivery quality essential healthcare services. And it is a clear consensus that quality healthcare services across the world should be effective, safe, and people-oriented and centered. Therefore, to be successful implementation of patient safety strategies, there should be clear policy, leadership capacity, and teamwork, data to drive safety improvement, skilled health professional, and effective involvement of patient in this care are all needed. And the most important strategy for this implementation is the leadership capacity and commitment. Now, current patient safety goal. It enhance the accuracy of patient identification, improve the safety of using medication, minimize patient trips and falls, minimize healthcare related infections, enhance communication between caregivers. Types of patient safety. These include medical safety, surgical safety, electrical safety, laboratory safety, sanitation, infection control safety, blood safety, equipment installation safety, or environmental safety. According to WHO, the occurrence of adverse event due to unsafe care is likely cause of 10 leading cause of death around worldwide, and in high-income countries, it is estimated that every 10 patient is harmed while receiving hospital care, and nearly 50% are being preventable. And 134 million adversements occur in hospital in low and middle income countries, according to recent data. And another study also showed that two-thirds of all adverse events resulting from unsafe care and year loss due to disability and death occur in low and middle income countries. And globally, as 4 out of 10 patients are harmed in primary and outpatient healthcare, and about 80% of harm is preventable. According to WHO, recent patient safety data, 421 million hospitalization each year, 42.1 million each result in adverse event, and 15% of all hospital activities and expenditures are direct result to adverse outcome. This also shows a figure. Now, according to various typologies of the adverse health, various events which can occur during patient treatment. For example, there is minor near-miss events which show that no harm or any minimal temporary harm. Then it comes the minor events which involve that no harm or very minimal temporary harm to the patient. Then come the moderate harm event, which include any event that causes discomfort sufficient to interfere with usual activity and requires additional specific therapeutic intervention, but poses no significant harm. Now become major near-miss harm, which include any event that would have been resulting in death or serious physical or psychological injury to the patient. This lead to major event, which is any event involving death or serious physical psychological injury, and these events should not be considered stuff, but that just happen, nor should they be considered inevitable. Why does this harm occur? According to WHO, a mature health system takes into account the increasing complexity in healthcare setting. A patient in a hospital might receive a wrong medication. There should be because there's a prescription at different levels of healthcare. There's lack of standard operating procedures, poor communication, and various health performance, flawless performance. and various at human level. Therefore, it is divided into three levels: a human factor, which include variation in healthcare professional training, depression, diverse patients, failure to acknowledge the prevalence of medical errors, increasing working hour of doctors, mislabeling of specimens, state of anxiety and stress. If we see the system failure, this include unsafe communication, which is the most important factor, unclear lines of authority, complications, disconnected reporting system within a hospital, fragmented system, drug names look like A like or sound A like, impression is that action is being taken by another groups within the institution. Reliance on automated system, inadequate system to share information, cost cutting measures, the environment and design factor, infrastructure failure. And if we see the medical complexity causes, there include complicated technologies, powerful drugs, intensive care or prolonged hospital stay. Therefore, according to recent Joint Commission report on quality and patient safety, showed that inadequate communication between healthcare providers or between providers and patient and family member was the main root cause of over the half of serious events in aggregated hospital during the last decades. And other leading causes may also include inadequate assessment of patient condition and poor leadership or training. Therefore, if we see the burden of harm according to WHO, medication error are the leading cause of injury and avoidable harm. And then come healthcare associated infection, which can occur in 7 out of 8 every 10 hospitalized patients. Unsafe surgical care procedures, unsafe injection practices, which can cause also hepatitis and B and C and HIV, diagnostic errors, unsafe transfusion errors, radiation errors. There may be overexposure to radiation or wrong patient and wrong side in the identification. There should be sepsis and various thromboembolic or blood clot, which is one of the most common and preventable cause of patient harm. Therefore, now come patient safety and universal health coverage. WHO identified that safety of patient during the provision of health services are safe and is high quality, and it should be prerequisite for strengthening healthcare system and making towards effective healthcare coverage system under the Sustainable Development Goal 3, which ensure healthy lives and promote health and well-being for all ages. And target 3.8 of SDG 3 is actually focused on universal health coverage, which include financial risk protection, access to quality essential healthcare services, access safe and effective water. And WHO responds according to patient safety that there should be resolution on patient safety, which is a global health priority. And WHO World Assembly adopted a resolution on patient safety, which endorsed the establishment of World Patient Safety Day to be observed by member on 17 September. And the purpose of World Safety Day is to promote patient safety by increasing awareness and engagement. Therefore, Patient Safety Day is celebrated on 17 September every year. And there are also key strategy action areas are also identified WHO, which include providing global leadership and fostering collaboration, setting global priorities, developing guidelines and tools, providing technical support, engaging patients and families for safer healthcare, monitoring improvements, conducting research in the area. This also shows the 5 keys which is given by WHO: leadership commitment, clear policies and guidelines, competent and compassionate health professional, engaging patient, using data, and all of this, the leadership commitment is most important strategy to improve patient safety. Various WHO strategies show clean care is safer care is also adopted in 2005, safe surgical save lives in 2018, medication without harm in 2017 is various WHO initiatives to date. And the various WHO friendly hospital initiatives are part of effort to reduce adverse and include all the process, for example, initiating, preparing, assessing, improving, and sustaining. Various factors are also influencing patient safety, which include patient error, clinical factors, delayed treatment, privacy, hygiene, security, technology, physical environment, human factor, for example, complex devices, training, cognitive, physical workload, product approvals from FDA. Now, patient safety challenges. The patient safety challenges, according to include patient delaying or avoiding medical care, data integrity or interoperability issues, physician burned out to be more important medical error, lower quality of care and reduced patient compliance. Not only does it affect patient safety, but provider safety and health as well. According to recent emergency care review, ISI, which is actually the US data, big data organization, which can always collect the data for 10 safety concern every year. And now for 2020, its streamline include type number one is staffing shortage, two is COVID-19 effects on healthcare workers, third is bias and racism in addressing patient safety, four is vaccination coverage, five cognitive biases, Sixth, non-ventilator health area-associated pneumonia. Seventh, human factors. Eight, international supply chain disruption. Nine, product subject to emergency use. And 10th is telemetry monitoring. Therefore, recommendation to improve the patient safety include communication. Lack of staff communication create adverse event. There should be implement a better safety culture, go transparent with quality safety data toward future mishaps, and key staffing with eliminate poorly managed work environment. Continuing education and awareness will decrease incidents and curtail hazardous conditions. Strive to achieve patient safety excellence award. Go after hospital acquired infection with vigilance and enhance your work performance with technology. Now there is a strategy which is given or action plan in 2020-2030, which is given by WHO, which include towards eliminating avoidable harm in healthcare. Its vision is to a world in which no one is harmed in healthcare and every patient receives safe and respectable care every time, everywhere. Its mission is to drive strategies based on science, patient experience, system design, and partnership. And its goal is to achieve the maximum possible reduction in avoidable harm due to unsafe healthcare globally. Its various strategies and given it include patient, families as partners, resulting through collaboration, evidence into improvement, policies and action. It includes policies to eliminate avoidable harm, high reliability system, safety of clinical processes, patient and family engagement, healthcare workers education, information research and risk management, synergy, partnership, and solidarity. These principles will guide implementation, as I already described, engaging of patient achievements that collaborative work, analysis of data, translation or translating evidence into actionable improvement, based policies, use both scientific expertise and patient expertise and there. And the partnership in action include governments, various national and subnational government, healthcare facilities and services, tertiary and secondary healthcare facilities, various stakeholders, NGOs and universities, academic institutions, and WHO's secretariat, which at various level, country offices, regional offices, and headquarters in this global action plan. The framework actually it consists of seven strategic objectives, which can be achieved through 65 specific strategies. And I already mentioned is one include make zero avoidable harm to patient. Second is build high reliability health system. Third is assess the safety of every clinical process. Fourth, engage and empower patient and families. Fifth, inspire, educate, skill and protect healthcare workers. Sixth, ensure a constant flow of information. And seven, development and sustain multi-sectoral and multinational synergy and partnership. These frameworks for action include 7.5 metrics is also given according to policy, which include policy 1 to eliminate avoidable harm, and various metrics are also given for action for high liability system and safety of clinical processes. Number 7. FD include the 7 by 5 metrics. For patient, family and community engagement also given. Healthcare worker safety include professional educational training, information research and risk management include various patient safety information systems, stakeholder engagement. There is also the ecosystem for implementation where global health strategy plan is also given that it is government, various point of care is given, and advocacy and application resource mobilization, there is a cycle. Then come the policy dialogue, needs assessment, policy design, intervention package, and evaluation. 10 core indicators are also proposed to measure the progress of these global action plan. Various strategic plan. Indicator 1 is the number of countries that have developed an action plan for implementing patient safety policies and strategies. Its various global targets are given. Indicator 2 is number of countries that have developed implemented for system for reporting never events or sentinel events. Its various percentages are given. In this strategic objective 3 is significant reduction in healthcare associated infections, and to up to 2030 it include to achieve 80% of countries. Indicator 3 and various indicator 4, which include countries that have patient representative on government board, and various 2030 target is 70% of countries to achieve. And strategic objective 5, number of countries that have incorporated a patient safety curriculum in education and program, and it include to achieve 2030 up to 80% of countries. Various strategic objective indicator 5, that country have signed up implementation of WHO health worker safety charter, and up to 2030 90% of countries should be signed up. And therefore strategic objective 6, number of countries that have 60% or more healthcare facility participating in patient safety incident And therefore, strategy objective 7, number of patients have established a national patient safety network, and up to 2030, 80% of patients should establish a national patient safety network. And there is also alignment of patient safety within the United Nations Sustainable Development Goal. Various SDGs are also linked with patient safety. For example, SDG 1, which is no poverty, SDG 3, good health and well-being, is also aligned with this patient safety. SDG 5, which is include gender equality, SDG 6, clean water and sanitation, SDG 8, decent work and economic growth, SDG 10, reduced inequalities, and SDG 11, responsible consumption and production. And these are various issues pertaining to patient related to patient safety and SDG 3. For example, SDG 3.1 include missed diagnosis of high-risk pregnancy, obstetric trauma, unsafe management, and 3.2 include unavoidable deaths of newborn, and these include birth asphyxia, immunization, safety errors in hospital, falls of newborn, failure to resuscitate, newborn sepsis. Same way, 3.3 and 2030 epidemic of communicable disease are also related issues, include safety issues, unsafe injection, occupational tuberculosis exposure, medication, misdiagnosis of MTB, and 3.4 reduced by one-third of premature mortality from non-communicable disease. Safety issues include polypharmacy, laboratory errors, safety issues in chemotherapy, radiotherapy, and failure to rescue. Similar way, 3.5 include failure to engage patients, self-harm and violent, drug abuse and addiction. 3.7 include complication of unsafe abortion, non-adherence to medical eligibility criteria, and 3.8 include achieve universal health coverage, including financial risk protection, include extended hospital stay, readmission, repeated procedures. 3.9 include environmental contamination, adverse effect from medical use of mercury, improper disposal of waste and effluents, and 3.c include healthcare work burnout, physical and chemical hazards, lack of expertise in healthcare worker. Now come the minimum service delivery standard for Pakistan. MSCS is actually a set of benchmark for minimum level of mandatory services that healthcare establishment is responsible to achieve and patient have right to expect. It is actually yardstick for essentially for all categories of healthcare establishment at primary, secondary, and tertiary level in Punjab and encompasses all the discipline of healthcare and focusing on ensuring quality healthcare services. These are implementation processes, for example, registration of healthcare establishment, then provisional licensing, third, capacity building, fourth, confirmation of implementation of minimum standard delivery, and fifth, assessment or surveys. This is a minimum standard delivery given for Punjab and secondary healthcare in Punjab. It bases it that it gives a good estimate of basic health needs of population. Basic health needs are actually help in determining the health needs of population. It basically have two principles. First, they provide a common set of requirements applicable to whole healthcare system. Secondly, they provide a framework for continuous improvement. It addresses minimum service package. It envisages a mandatory requirement, create conducive working environment for healthcare workers, and ultimate impact of minimum standard delivery would provide effective and healthy workforce for the economic development of the country. Various conceptual framework are given, for example, burden of disease, communicable and non-communicable, services according to problem, standards, minimal acceptable, resources, man, material, money, delivery, SOP, standard protocol, specific for all levels. And it is actually there is a clinical governance framework which is through which organization accountable for continuing improving the quality of services and safeguarding high standard of care. MSDS in Punjab actually follows various functional areas. It includes assessment and continuity of care, care of patient, management of medication, patient rights and education, hospital infection control, continuous quality improvement, responsibility of management, faculty, facility management, human resource management, information management system. And there is also category of healthcare establishment 1, 2, 3. For category 1, if the hospitals are having 550 or more beds, category 2 of healthcare establishment according to MSDS hospital having bed strengthened from 1 to 49 beds, and category 3 health hospital care establishment include BHUs, GP clinics, dental clinics, homeopathies, laboratories, imaging, radiological diagnostics. These are various services package are given according to MSDS. For example, immunization package services, Preventive services include immunization package, which include and minimum level acceptance, including EPI. At least 90% children aged 1 year should be immunized against 7 diseases, and minimum 80% of mothers of childbearing age should receive TT injection during pregnancy at all levels. There's also antenatal level physical examination, laboratory measure, and more than 80% of pregnant women should be have at least three properly spaced antenatal care visit at all levels. These are preventive measures. There is also neonatal care package. There are more than two-thirds of deliveries should be conducted by skilled birth attendant. Postnatal care, that at least two-thirds of all women should receive postpartum care. Intranatal care, prevention and management of sexually transmitted disease, that all patients who are reproductive should attend healthcare facilities appropriately. There should be family planning services package. Nearly two-thirds of eligible couples will be provided knowledge and information on family planning. There is also major micronutrient deficiency. There should be universal awareness campaigns on media, fortification of vegetables and vitamin E, mental health identification, diagnosis. There should be counseling services at all levels of care. There should be screening of local burden of disease, screening of all prevalent health disease, hypertension, diabetes. At all health facilities should be carried out. There should be outreach services and, for example, community health worker, postnatal care, ANC visits, family planning services, and at least 80% women of childbearing age of catchment area should be provided with these services. There should be ECCD, nutritional healthcare, environmental safety, and early child education, and at least specialists of essential specialists should provide services. Then come promotive services under this MSDS package, which include health education, awareness regarding immunization, prenatal, postnatal care, family planning, good nutrition practices, and their minimum level of acceptance include regular national and local campaigns on media, print media, electronic for important health issues at all levels. There should be basic emergency obstetric care services, for example, manual removal placenta, retained products, and all facilities should have arrangement for basic EMOC services. There should be comprehensive emergency obstetric care services. For example, all DHQ and THQ should have arrangements for comprehensive emergency care services, and they should also skill sick child up to 5 years of age, malaria, measles, and ear throat infection. Surgical outpatient services, mortality review should be at least conducted at DHQ, AHQ services, surgical and others should be emergency services free of cost. Trauma services, burns, blood transfusion services are also present. Diagnostic services, for example, routine urine examination, sugar examination, blood bleed examination. Then come rehabilitative services under this package, which include non-invasive care, for example, prevention of symptomatic care, correction of anemia, treatment of secondary infection, and all patients requiring any type of rehabilitation should be provided at appropriate level of care. Then come invasive under rehabilitative surgical treatment. Then come national programs, HIV, AIDS and control program. There should be behavior change communication through media. There should be 100% of screening of blood and its product, and 80% of HIV positive should have CD4 lymphocyte count done, and all those have found less than 200 should be given antiviral therapy. National TB control program, there should be case detection rate up to 70%, door treatment up to 85%, default rate less than 5%. Malaria control, all fever cases should have blood studies for malaria, parasite by rapid kit test, and all positive should receive radical treatment for malaria. There also national program for family planning, that population coverage 80% of regarding family planning services. And then Prime Minister program for prevention and control of hepatitis. There should be behavior change at all level, 100% screening of blood, and ensuring 100% use of disposable syringes in all public health facilities, and vaccination of hepatitis B. Then school health services, there should be screening of school children for eyesight, speech, hearing impairment, skin disease, anemia, and school health services in all public sector schools. National program for prevention of control and blindness, there should be capacity building and training for eye health of all at all levels. These are all promotive services. Now come the some recent advances. A paper is published which show a patient's safety challenges in primary healthcare scoping review. These can identify the various patients described by health professional in primary healthcare. Result shows that the four categories are resulting from analysis: challenges of healthcare professional, there should be administrative challenges of health services, challenges with the patient and family, potential enhancing resources for patient safety, and The result of this analysis showed that conclusion showed that the patient safety challenges from primary healthcare professional are multiple and complex, and this study provides insight into resources to provide patient safety to healthcare professionals. Another paper is also published which show actually to assess medical student perception about patient safety issues before the teaching of patient safety. This cross-section study is carried out in Dow Medical College in Karachi, and its results show that 229 medical are participated in the study, and overall 57% of students agree that medical errors are inevitable, and 46% that thought competent physicians do not make error, and 74% students said that medical error should be reported, and thought reporting system do not reduce future errors. And overall, this student said 96% of all students agree that patient safety is an important topic, and 93% agree that there should be a part of medical curriculum said that which should be learned how to disclose medical error to patient, and 90% of faculty members. Therefore, study conclude that there is a significant knowledge gap exists among medical students regarding patient safety challenges, and the teaching of patient safety was highly supported by students and need to be included in medical curriculum on an urgent basis. Now it is come for time for MCQs. MCQs 1. A patient safety is an organized framework for creating culture, processes, behavior, technologies, and environment that consistently and sustainably meet the need of patient in healthcare by alpha consistently increase risk, beta increase the likelihood of error, C increasing healthcare infections, related infection, delta increasing the impact of harm, E reducing avoidable harm.
E.
E.
Okay, E will be the correct option as the patient safety is primary objective is to reduce the avoidable harm. Therefore, E will be the correct option. MCQs 2. An ABC 45 years old woman is in the medicine ward for asthma treatment. She has given antihypertensive medicine instead of anti-asthmatic medicine at the 8 a.m. dose by nurse on the ward. The cause of this poor quality healthcare is due to alpha diagnostic error, beta healthcare associated infection, C medication error, delta radiation error, C surgical error.
C.
C.
C will be the correct option as this is a medication error. She is given antihypertensive drug instead of anti-asthmatic. So C will be correct option. MCQ 3. Patient safety emerge from equally conceptual healthcare quality concept with a variety of approaches to be more concrete essential component. The main root cause over half of the serious adverse event in most aggregated hospital is alpha diverse patient, beta inadequate assessment of patient condition, C inadequate communication between healthcare providers, increasing working environment of medical professional, poor medical training. What will be the correct option?
E.
C will be the correct option. Inadequate communication between healthcare workers are root cause in a serious adverse outcome in nowadays in most accredited hospital. MCQs 4. 6 cancer patient at XYZ hospital recommended 6 months of radiotherapy. It is recommended that dose error should be kept less than 5% of prescribed dose. The dose error was calculated to be greater than 17%, 7% of the first month of radiotherapy treatment. The cause of this poor quality healthcare is due to alpha diagnostic error, beta healthcare associated infection, C medication error, delta radiation error, E surgical error.
D.
Delta
D.
correct option as there is a radiation error. MCQs 5. Various policies and practices of healthcare organization in ABC country where their work have forced people to use patient safety practices different ways with varying results. For ABC country, patient safety practices implementation to be successful, one of the following broad context feature is needed at high priority. Alpha clear policies, beta patient safety culture, C skilled healthcare professional, delta specific organizational characteristic context, E teamwork and leadership commitment.
B.
B.
The correct option according to WHO strategy, the teamwork and leadership commitment is most important to ensure patient safety measures to achieve maximum result at high priority. MCQ 6. ABC country healthcare system is not as secure. Each year, at least 44,000 people and possibly as many as 98,000 die in hospital as a result of preventable medical error, according to estimate from two major studies. Which of the following is a factor that contributes to healthcare errors due to human error? Alpha environmental design factor, beta healthcare workers training, variation, C inadequate system, B delta infrastructure failure, E reliance on automated system. But
B.
Beta will be the correct option as the human error is healthcare provider training variation or other are the system errors. MCQ 7. The ABC Health Department found that neonatal and maternal mortality rates have risen in the last decades in XYZ BHU. An investigation found that BHU is currently run by junior healthcare providers who lack clinical skill, knowledge, and behavior. Which of the following key strategies most critical to improve patient safety in this case? Alpha, clear policies. Beta, patient safety culture. C, skilled healthcare professional. Delta, specific organizational characteristic context. E, teamwork and leadership commitment.
C.
C.
See, in this scenario, there should be skilled healthcare professionals because doctors are running junior healthcare and which are responsible for increased maternal mortality in this scenario. MCQs 8. Patient safety and quality is an important part of successful universal healthcare system. It is also an important aspect of strengthening health system in developing countries. The goal of STD dash is to improve the health and service quality of patient. Alpha STD 1, beta STD 2, C STD 3, delta STD 4, and E STD 5.
B.
C will be the correct option as the C is SDG3 is health for all, health for and well-being, which can also associated with improved health and service quality of patients. So C will be the correct option SDG3. MCQs 9. Two large healthcare hospitals establishment in ABC city, both of which provide curative and preventive services to general public, each had 50 beds or more. The following are the categories of these two healthcare centers in MSTS. Alpha category 1, beta category 2, C category 3, category 4, or E category 5.
A.
Yes.
B.
Alpha will be the correct option as I already mentioned in minimum standard delivery in Punjab. If every healthcare establishment have 50 beds or more, it comes under the category of 1. Alpha will be the correct option. MCUs 10. Minimum service delivery standard for preventive immunization package in XY city of ABC developing countries is that they include immunization against 7 diseases for at least dash percent of all infants aged 1 year. Alpha 30%, beta 40%, C 50%, delta 60%, E 90%.
D.
E will be the correct option. As I already mentioned in various promotive preventive services of minimum service delivery standard packages given by Punjab, that there should be at least 90% of coverage of the immunization against 7 diseases for at least of all infants of age 1 year. Therefore, E will be the correct option 90%. This is the key of my MCQs and thank you.
Thank you so much, Dr. Khansa. You can end the meeting.